Emergency room visits are up, and doctors say there is a link between new marijuana legislation in California and the symptoms many patients are experiencing. Dr. Race Vora explains. Right now, we are seeing an increase in emergency room visits. So, doctor, we want to talk to you about why exactly we're seeing that. You guys are kind of linking it back to one particular thing. What is that?
Yeah, you're basically hearing a lot of news stories about people that are increasingly exposed to marijuana, especially in this era of increased availability and the deregulation that we've recently experienced. More and more people in our community are experimenting with this substance and using it perhaps on a more frequent basis than they were before. And we're seeing several different types of emergency department visits related to it. In the adults, what we tend to see is people that may be using it chronically or are using it on a habitual basis, and they end up having something that we call the hyperemesis syndrome. Sometimes it's known as the cannabis hyperemesis syndrome. And that's characterized by, it's an unusual picture in that they just have a lot of vomiting and nausea, and it can be lasting days to weeks. And the only thing that seems to relieve it, for some weird reason that we're still trying to figure out the science behind, is that they have to take very hot showers. The strains that people may be using are more potent than they have been in the past. They're probably using them at a frequency that's greater than they have before. And there may be patient factors where the more people in a population are exposed to it, the more we are able to discover some of these complications that were very rare before, but are now coming to the fore and becoming more common now. What
are some of the main symptoms that you guys are looking for to attribute?
Typically severe vomiting, dehydration, abdominal pain, diarrhea sometimes occurs. People just are not very happy.
Why do you think there's such an uptick in that?
Well, that's a great question. Certainly, we're seeing more people in the community using this substance, either recreationally or for medicinal purposes. And we're also seeing that there's different strains that are being developed, and they're more potent than what we've seen in the past. And I think the combination of those factors is leading some patients to have this complication.
And it's interesting to note, too, that it's not just smoking marijuana. There's other ways.
That's correct. Smoking is just one way that people are able to get access to the marijuana. There's also edible products that they can use. They can actually get access to butter or oil and then use that in their cooking, or just get edible products ready-made that contain the THC and other oils that would contain the marijuana substance. There's even creams and lotions that people are starting to use for neuropathic pain and other types of pain symptoms.
So what do you think the solution is? How do we fix this problem?
Great question. The science is still not quite worked out, so we're still learning more and more about exactly what's going on in a person's body by the time they get this syndrome. And once we establish the diagnosis that this is the hyperemesis syndrome related to cannabis, then we can start to retreat the patient with rehydrating them with either IV fluids, or if they can drink fluids after we give them some nausea medicine, we can try to give them some nausea medicine. What we do know is that once people stop smoking or ingesting the marijuana, that this syndrome seems to kind of cure itself. So what we tell people is, if you could just stop the exposure, that this syndrome will take care of itself sooner or later. And in the meantime, we'll try to do other medications and see what works.
Okay, certainly need to be careful.
That's right.
Doctor, thank you so much. We appreciate your time.